Now, have you ever used 111, the NHS helpline? You may well have done, because it had a record number of calls last month. It answered very nearly 1.2 million calls in July. Now, NHS England said that over half of calls also received input from a professional clinical advisor, the highest proportion since the helpline was introduced. So, is the service reducing pressure on the rest of the health service, and are patients getting the help they need? Let's talk to our very favourite doctor, Kishan Rees. Good to see you, Kish.
Morning.
Is this a good way in for people to get access to health advice? It's certainly proving popular.
I think it's a good option, but I think we have to look at it in the picture of the overall service. So if people are struggling to get GP appointments and they're struggling, there's a long way to A&E, then that might be why there's a lot of calls going to NHS 111. And so, yes, it's an option, but I think it's part of an underfunded system that's struggling, basically.
But because the system is struggling, I mean, there's no two ways about that. There's no even political argument about the fact it's struggling. Because it is there as an option, is it proving to be a sensible option in terms of people getting the correct advice from the correct people?
I think in some cases, yes. I think some patients that use it get good service, but equally, I've thought about this previously as an A&E doctor and when I see patients from those two perspectives. It was only last night that I started talking to some of the staff in the call centres to find out the real struggle that some of them, in terms of training, have absolutely horrific working conditions. You can imagine working in a call centre and then getting shouted at when people's health is on the line and people having to wait hours for ambulances and people getting really annoyed at that. So I think there are problems with the service. I'd say over the weekend, if people ring the service and it helps and it works, then that's great, that's fine. But if you're ending up waiting hours for a callback or hours for an ambulance, don't delay, go to A&E, go and see a doctor.
Yeah, but presumably that's the advice that 111 is giving out. You know, they go through the checklist, and if they've got any real concerns about someone's immediate health, they will be saying, you need to go now.
Well, it's interesting. Some of the problems are around this checklist, because I was speaking to some nurses that are experienced nurses and they're not allowed to deviate from the algorithm. And you can have patients that phone 999, 999 says, no, you don't need an ambulance, and then the patient phones 111, and then the ambulance is dispatched from 111. So we need both systems to communicate with each other. And I think it's really important, especially with this NHS app that's coming. This book, The Blunders of Our Governments, the collective governments, they're talking about how the NHS Direct Service was scrapped and then 111 was brought in without any evidence, and it was actually, going back to your first point, there was papers in the first year saying that it might drive use. It might drive people going to an already struggling service, which I would say is being failed by successive governments.
But there's no evidence of it driving use towards...
There is, yeah. There's a BMJ paper of 2 years after, 1 year and 2 years after the first use, studies on the BMJ online, open access articles were saying that services like this may drive use to an A&E service.
But what's the alternative to that? I think the fact that you can't get a GP appointment very easily. I mean, is the alternative scrap 111 and just let people blunder through?
No, definitely not. I think have it as an option, of course, but we need an appropriately funded GP service where GPs are working and they're working in conditions where they are living healthy lives themselves. And the same for the A&E doctors and the call centre staff in NHS 111. Some of the stories that I've heard in terms of managers kind of shouting at them, supervisors just being interested in statistics. There was a tragic case in January of Emma Alsop, who sadly killed herself in the middle of a shift after 4 12-hour shifts. She was found hanging in the toilet. I mean, that is just absolutely horrific. So if we're putting call centre staff under that much pressure and experienced nurses are struggling with, you know, using their clinical acumen with these algorithms, then I think we need to think about how the service is run.
OK. Kishan, good to see you. Thank you.